Good morning once again, and welcome to the episode 2 of lecture 2. Still on the topic, the value of research and evidence-based practice. These are the objectives we would like to achieve at the end of this session. So we are saying by the end of this session, students would be able to 1. Explain the concept of evidence-based practice. 2. Differentiate between research utilization and evidence-based practice. 3. Analyze how evidence-based practice can be incorporated in nursing practice. So first of all, what is evidence-based practice? So according to DeCenso and his colleagues, 1998, they defined evidence-based practice as the process by which nurses make clinical decisions using the best available research evidence, their clinical expertise, and patient preferences in the context of available resources. Then Sackett and his colleagues, also in the year 2000, defined evidence-based practice as the integration of best research evidence with clinical expertise and patient values. Then in the year 2001, the Institute of Medicine also defined evidence-based practice as the integration of best research evidence, clinical expertise, and patient values in making decisions about the care of individual patients. So in all the definitions that we actually analyzed, these 3 components were found in all the definitions. 1. Research evidence. 2. Clinical expertise. And then 3. Patient values and circumstances. So in the year 2003, the Institute of Medicine actually gave these 3 components of evidence-based practice. That is, for a nurse to take any clinical decision on a patient or group of patients, then he or she needs to actually take into consideration research evidence, his or her clinical expertise, and also consider the patient values and circumstances before that nurse will be deemed that he or she is engaging in evidence-based practice. So evidence-based practice actually possess these 3 components, and that is what we are advocating for. Now, we said the best research evidence. So what type of studies or research can be categorized under the type of research evidence that we need for evidence-based practice? So here we have randomized controlled trials, laboratory experiments, clinical trials, epidemiological research, and qualitative research. So all these type of studies fall under research evidence, and such studies, the findings of such studies can be actually incorporated in nursing decision taking. What about the clinical expertise? What are we actually talking of? Here we are referring to the knowledge gained from nursing practice over a period of time, and also we are actually referring to the inductive reasoning of nurses. Then when we say patient values and circumstances, what are we trying to refer to? So here we are trying to refer to the unique preferences of patients, patient concerns, expectations, financial resources, and social supports. Now, let's introduce this concept, research practice gap. What is research practice gap? It is the apparent disconnect between research and actual practice, or it is the gap that exists between what is known from research and what has been applied in research. And we are seeing this gap has led to substandard patient care. Actually, there is a disconnect between research and actual practice. That is, nurse researchers try their possible best to do research and bring out evidence or findings. Now, these type of findings are not put into actual practice, and therefore it has caused a research practice gap. Either after the research, their findings, they don't communicate to the nurses who are actually practicing nursing in the hospitals, and therefore they are also not using their findings, and this has led to what you call the research practice gap. Or maybe they might be communicating their findings to the nurses in the facilities, but they are not actually implementing in their clinical decisions, and this has caused what we call the research practice gap. So now, how can this gap be bridged? So we are saying, if we want this gap to be bridged, this research practice gap to be bridged, then we need to consider research utilization and evidence-based practice. These are the only two means by which we can bridge the gap between research practice gap. So now, what are the differences between research utilization and evidence-based practice? In short, when we talk of research utilization, is the use of research findings from a study or set of studies in a practical application. Or in other words, is a way of translating new knowledge into real-world applications. What of evidence-based practice? Is the integration of research findings with other factors such as clinical expertise and patient values in making decisions about the care of individual patients. So here, research utilization is simply talking of how research findings can be used or can be applied. But evidence-based practice is talking of how we are going to integrate the research findings with the clinical expertise of the nurse and then the patient values in taking decisions about the patient or group of patients. So you could see that research utilization is a narrower term, whilst evidence-based practice is a broader term. Now, how can nurses incorporate research into their practice? Because we are calling for evidence-based practice. So how can nurses actually incorporate research into their nursing practice? So we have 5 steps. So one, we are saying formulating a well-built question. That is, the nurse should actually use the patient scenario to formulate a well-built question. Now, after you are able to formulate the question, then it is important that the step 2, you search for articles and other evidence-based resources that answers the questions. Then the third step is for you to critically appraise the evidence to assess its validity. That is, after you search for articles and other evidence in order to answer the questions that you formulated in step 1, you need to critically evaluate the evidence in order to assess its validity before the step 4, you apply the evidence. Then after applying the evidence at the step 4, the step 5 is for you to re-evaluate the application of the evidence and actually look for areas for improvement. Then finally, let's look at the challenges of evidence-based practice. Now we are advocating for evidence-based practice and research utilization, but they have challenges. And the challenges are categorized into 3: research-related barriers, nurse-related barriers, and organizational barriers. When we talk of research-related barriers, we are talking about the type of terminologies or jargons or the type of statistical manipulation that are incorporated in research articles. These actually deter or prevent nurses from reading because normally they don't actually understand those kind of jargons and statistical manipulations. What about the nurse-related barriers? It's talking about the attitude of nurses towards research. Some nurses actually dislike research. Some actually don't have any idea about research, and it is posing a challenge to the practice of evidence-based practice. And then the third challenge is the organizational barriers, where organizations or institutions are not giving the support for nurses to engage in research. So, this is the end of the episode 2 of lecture 1. These are the references. So, if you want to read more on this, you actually find the information in the following sources. These are, thank you for your attention.